So I'm going to do a quick QSIN on Mr. Jones here. I'm going to check his wristband, ask him his name and date of birth, and make sure that it matches. Make sure his whiteboard is updated and everything's correct. He doesn't have any oxygen on right now. No NG tubes, no abdominal tubes, no chest tubes, and no Foley catheter present. He only has a right AC IV saline lock, and there is no redness, swelling, or drainage present. He has 3 side rails up. His bed is in the lowest position. There are no obstacles around him. He has his water and urinal within reach, and he also has his call light within reach. And now I'm just going to do a head-to-toe assessment on Mr. Jones. So I would knock on the door. Hi, Mr. Jones. My name is Grace. I'm going to be your nurse today, and I'm going to do a quick head-to-toe assessment on you. I'd wash my hands, put my gloves on. I'd say, can you tell me your name? Okay, Mr. Jones. Do you know your date of birth? Okay, and do you know where we're at today? He knows we're at the hospital, so he's alerted and oriented ×3. And I'm first going to check his vital signs. I'm going to take his temperature, and it is 99.14 degrees Fahrenheit, slightly elevated. I'm going to check his pulse. It's present bilaterally, and his pulse is irregular and weak. And the rate is 104. And now I'm going to check his respiratory rate. He is extremely short of breath, and his rate is at 26 right now. Now I'm going to check his blood pressure, his right arm sitting up, and it is 150/72. I'm going to check his pulse ox, and it is a little lower at 91 right now. Alright, now I'm going to check out his skin on his top half. I check his skin turgor. His skin turgor is good. It is elastic. And he's pink, warm, and dry up here. Are you having any pain anywhere? He says he's having pain in his abdomen. Can you rate it on a scale of 0 to 10 for me? It's about a 5. So I'm going to listen to his lung sounds, because that is the priority right now. He has crackles present bilaterally, indicating fluid buildup in the lungs. And he has a cough. Is your cough productive? And he would tell me yes. And in his case, it would be pink tinged because there's blood in his lungs. And then he is short of breath. And I would then likely put him on oxygen starting at 2 liters to see if that would increase his oxygen percentage and help with his shortness of breath. I'm now going to check his apical pulse for a full minute due to his AFib. S1 and S2 are present, and it's an irregular beat. I would check his JVD sitting up. He does have JVD noted. And then I'm going to check it lying down. And JVD is also noted. So I'm going to sit him back up. And I'm going to check his 6 P's in his fingers. Alright, can you push against my hands? Okay, he was able to push. Can you pull back? Can you wiggle your fingers for me? Alright, so his pulses are present. His radial pulses are present bilaterally. His skin is pink. There's no edema present in his upper extremities. Do you have any numbness or tingling? He denies numbness or tingling. And he had a little bit of weakness when he was pushing and pulling against me. And you said your pain was in your abdomen, so I'm going to listen there. Looking at it, his abdomen is rounded and firm. And I'm going to listen first. In all 4 quadrants. So bowel sounds are present in all 4 quadrants. And I'm going to, is there any pain when I press on it? And he said yes, and one in this area here. And I asked him what provokes it. And he said any movement. And I would guess that he has ascites for me due to the fluid buildup. Can you tell me your last bowel movement? His last bowel movement was yesterday, April 1st. Are you passing any gas? He said yes. Any constipation or diarrhea? No. Any nausea or vomiting? And he tells me no. And he doesn't have a feeding tube. And his urine is yellow and cloudy. Are you having any urinary frequency pain or burning? No. And okay, now I'm gonna check his IV site, which I already did before. There's no redness or swelling present. And I'm going to check out his feet. Alright. Can you push against my feet? Can you pull back? And can you move your toes for me? So he's able to do all that, but he was just very weak due to his fatigue that he came in with. I would check his cap refill. And it is longer than 3 seconds. I forgot to check the cap refill in his fingers, but it was also longer than 3 seconds. And then he has no edema in his lower extremities. Any numbness or tingling? He denies numbness or tingling, and he's able to move his digits for me, and his pedal pulses are present bilaterally. So based on his assessment, Mr. Jones needs to get rid of the extra fluid in his lungs with administration of a diuretic such as Lasix and also medication such as vasodilators to control his blood pressure and heart rate to allow his heart to rest due to the heart failure. He needs to continue to be closely monitored for fluid volume excess and respiratory status. So after this, I would leave him with his head of bed up in high Fowler's, with his oxygen on, and his 3 side rails up, and his call light within reach. And I'm now going to report off to the nurse of the next shift. So I would say Mr. Jones came into the ED from his primary care physician complaining of general fatigue for 4 days, shortness of breath, and abdominal discomfort. He has a history of coronary artery disease, hypertension, and has had blockages with stents placed. His chest x-rays showed bilateral pulmonary edema and a ECG revealed AFib. He has been transferred to the CCU for hemodynamic monitoring and aggressive therapy. He is on 4 liters of nasal cannula, plus in a high Fowler's position, and his SpO2 is at 96%, which is adequate right now. And he has received furosemide 80 milligrams to excrete the excess fluid in his lungs, and digoxin 0.5 milligrams to decrease his heart rate. via his right AC IV.